Coronavirus has created an unintended consequence when it comes to childhood vaccinations. Many parents are putting off their children's well visits, and that includes getting vaccinations doctors say are critical in keeping our children safe. Beth Ward joins us live from home with answers to many parents' questions and fears about bringing their kids into the pediatrician during the pandemic. Beth?
Well, Jordan, it can be scary during this pandemic time and so many question marks. Many parents want to know, one, is my pediatrician's office even open? And two, is it safe? So tonight we spoke to a local pediatrician, digging deeper to get you the answers on what every parent needs to know when it comes to keeping up with their child's vaccinations.
I think there's a lot of fear in the community about COVID-19 and their impact on children. And they're hearing the message from the governor and others to say, stay home unless it's absolutely necessary.
Bay State Medical Center pediatrician Dr. John O'Reilly says the number of visits to his office is down, and that means so are the number of vaccinations.
I think we do want to get the message out there that vaccinations are a critical part of their children's health, and we need to bring their children in to get their vaccines to prevent other diseases besides COVID-19.
In fact, the Massachusetts Department of Public Health says vaccine doses ordered were down 39% in March, 68% in the first 2 weeks of April, compared with last year. Dr. O'Reilly tells Western Mass News he wants parents to know pediatrician offices are open and are safe.
Pediatricians are working hard to let parents and families know that pediatric offices are a safe place to be. We are screening patients that are coming in to make sure that if the patient or the parent has signs of illness, a fever, a cough, or shortness of breath, that they are being masked, that they are being treated differently, and that no one is waiting in a waiting room spreading illness.
He says by and large, for a child, not keeping up with vaccinations could create a greater risk than COVID-19.
Children who get measles are more likely to die than children that get COVID. The same for some of the other vaccine preventable illnesses.
Preventable illnesses, he says, like pertussis, meningitis, and pneumococcal pneumonia.
I think the COVID-19 pandemic has really shown parents that using vaccines to prevent diseases is really important.
Now, the American Academy of Pediatrics says if you have any questions, simply contact your own pediatrician and be sure to ask the question what types of safety procedures they have in place before you schedule a visit. Reporting live from home, Beth Ward, Western Mass News.